Abstract. Each year an estimated 400 million are infected, 100 million show symptoms of and roughly 22,000 die from the endemic of a filovirus named dengue fever virus, henceforth DENV, according to the CDC. DENV currently affects 128 countries and primarily affects less economically developed countries in tropical or subtropical climates, leaving approximately 40 to 50% of the world's population at risk. DENV's symptoms range from mild fever to dengue hemorrhagic fever and shock syndrome. The virus can be contracted up to 4 times due to the 4 serotypes of the virus, and it would seem each time one contracts the virus, they experience worse symptoms. These 4 serotypes are spread by the Aedes mosquito family. Ae. Stegomyia, Ae. Albopictus, Ae. Polynesiensis and Ae. Niveus subgenesis of Aedes are the 4 main classifications that spread dengue. Although there is no cure for DENV, proper medical care can lower fatality rates to below 1%. The creation of a vaccine has created new problems, could lead to the pushing of the anti-vax movement, encapsulating the internet. Global burden. An estimate by the World Health Organization indicates there are approximately 390 million infections each year of DENV, and of those around 96 million manifest clinically. Reported cases are much lower, but numbers have increased from 2.2 million in 2010 to 3.34 million reported cases in 2016. There are multiple factors going into this, the most likely being the increase of mosquitoes. Due to higher access to travel, the number of countries suffering from DENV has increased from 9 countries in 1970 to 128 countries in 2016. Tropical and subtropical areas are at the highest risk. Occasionally there are outbreaks in the United States, although they tend to be rare because nearly all cases in the states are from recent travelers who contracted in different counties. Recent homebrewed outbreaks include Hawaii in 2015, Florida in 2013 and Texas in 2013. Structure of the dengue virus. The DENV genome is a positive RNA strand, as seen in Figure 1, classifying it as a filovirus. The mature filovirus is right around 50 nm in diameter. DENV has an outer protein and a nucleocapsid core containing the ribonucleic acid or RNA. A nucleocapsid core is a unit of a viral structure consisting of a capsid with nucleic acid inside, typically found in the cytoplasm. Amongst the 4 serotypes, the E proteins have a 60 to 70% amino acid similarities. The serotypes are just different enough that a victim can be infected with the virus up to 4 times. The virus delivers and infects in the epithelium. From there, the virus takes infected cells to the lymph node, where it replicates and eventually leading to symptomatic infection. Virus and symptoms. DENV ranges from asymptomatic to dengue hemorrhagic fever, DHF, and can turn into dengue shock syndrome, DSS. DENV typically lasts 5 to 7 days with symptoms varying by age. The first exposure is referred to as the primary infection and may or may not result in symptomatic infection. The secondary infection usually results in the typical symptomatic DENV infection and 2 to 3% results in DHF. Most infections result in no symptoms, but if they do, symptoms appear after 4 to 7 days. The typical DENV results in high fever, headache, muscle, bone, and joint pain, nausea, vomiting, etc., and most people recover within a week. DHF can cause severe abdominal pain, persistent vomiting, bleeding from the gums or nose, etc. If any of the symptoms for DHF appear, it is recommended for one to see a doctor, as it could result in dengue shock syndrome or DSS. Vaccines and strategies. CTDV, henceforth Dengvaxia, became public in 2015, and due to complications, the Dengvaxia is a combined vaccine for the yellow fever virus and the dengue virus. World Health Organization recommends countries in high-risk areas to give this vaccination only to children over 9. The reason for this is if there was no prior exposure to the virus, Giving the child the vaccine creates an increased risk of developing DHF. The vaccine is administered in a regimen of 3 doses over 6 months. Vaccinating at-risk children over 9 reduces severe infection and hospitalization by 80%, but many parents and government officials are reasonably concerned about that leftover percentage. Member of the government in the Philippines made a fear-mongering Facebook post saying that this is the biggest government-funded clinical trial masked as a public health program scam of an experimental drug in the history of the DO. This was reckless and irresponsible from the start, and the public was deceived into thinking this vaccine would protect children from dengue. Vaccine and Strategies Part 2. There are many different types of vaccine that have been attempted for DENV, such as live attenuated viruses, LAV, targeted mutagenesis-based live attenuated vaccine, TBLOV, chimeric dengue vaccine, and non-replicating viral vaccine. The LAV reduces the impact of all 4 serotypes but did not bring a balanced response, which also increased adverse reactions. TBLOV brought up the idea that one fix was to delete nucleotides. Further evaluation needs to happen in order to decide if this is a good route. There have been 2 chimeric vaccines, one made with another flavivirus, one with another DENV strain, intertypic. The dual flavivirus contains DENV and yellow fever and is under the name of Denvaxia. The intertypic vaccine deleted PDK cells from the serotype 2 of dengue and replaced it with genes from dengue 1, 3, and 4. The non-replicating viral vaccine was an inactivated monovalent vaccine, was found to be safe in mice. Conclusion. In conclusion, the endemic of DENV has captured the people of over 100 countries, leaving around 50% of the world's population at risk. There is a desperate search for a viable vaccine has led to one that can only be taken under certain conditions. The most ethical approach that is being suggested is to inform families about the risks. A study showed that people were hesitant to vaccinate a fake child if there was a risk for death, even if the risk was higher if the vaccine was not given. These people were more afraid of having a potential hand in death than condemning the child by doing nothing. The problem with pushing the vaccine is not only could it cause a backlash, but it could also lead to greater skepticism of vaccines in general. A suggestion by the WHO is for pre-vaccination screenings to be able to tell if patients have had the virus before.